Good morning, Robert Soto here, student physical therapist assistant. Today we're going to be talking about ultrasound and electrical stimulation combo. First, we're going to talk about the benefits that these modalities have. Then we're going to discuss some research I found about how therapists nationwide are using this combo to treat chronic pressure ulcers. To finish up, we're going to go ahead and talk about the contraindications, precautions, and application of this combo. To get started, we're going to go ahead and talk about the benefits that these modalities have when used individually. Ultrasound works well with patients with osteoarthritis, myofascial pain, bursitis, carpal tunnel syndrome, pain caused by scar tissue, phantom limb pain, and also sprains and strains. Electrical stimulation works well with patients with back pain, cancer-related pain, dysphagia, joint pain, arthritis, muscle conditioning, muscle injury from trauma or disease, poor muscle strength, urinary incontinence, spinal cord injury, and stroke. Finally, to the indications of both electrical stimulation and ultrasound used together. Decrease acute and chronic musculoskeletal pain, decrease muscle tone spasm, increase local circulation, increase and maintain joint range of motion, and relieve pressure ulcers. After discussing the benefits of ultrasound and e-stim, it's now time to talk about the research. When I was doing my research, I found many articles about how ultrasound and electrical stimulation benefited patients with pain and stiffness. However, one topic that really intrigued me was the use of ultrasound and electrical stimulation for the treatment of chronic ulcers. This intrigued me because ulcers is not the first thing I think of when I think of how ultrasound and electrical stimulation could be used to treat a patient. In my two research articles labeled Evaluation of a Device Combining Electrical Stimulation and Ultrasound in the Treatment of Non-Healing Chronic Leg Ulcers and Combined Ultrasound and Electric Field Stimulation Aids the Healing of Chronic Pressure Ulcers, I found a lot of information about how ultrasound and e-stim is used to treat chronic ulcers, and it makes a lot of sense. As discussed earlier, ultrasound and e-stim are both very good for improving circulation and for tissue healing. So why not combine them to treat some ulcers? In these two articles, they discussed how these modalities were used together to treat these ulcers. First, they discussed the device that they used to treat these ulcers, which was named the BRH-A2. This is a device on the more expensive side that combines ultrasound and e-stim to treat patients. After they described this device, they went ahead and described the patients that were used in this clinical study. For both articles, the patients were those in nursing homes that were more susceptible to ulcers. In my first article, they talked more about patients with leg ulcers. They only talked about patients with leg ulcers. In the second article, they talked about patients with ulcers to the sacrum, to the heels, to the knee, and to the hip. They described how these patients improved with the use of ultrasound and e-stim on their ulcers. The improvements were shown by closure of the patient's ulcers and also by increased functional activity after a number of treatments. In conclusion, both of these research articles were in favor of the use of ultrasound and electrical stimulation when treating patients with chronic pressure ulcers. That is because almost every patient that was treated with these modalities in combination had improved tremendously. The only difference in these articles was that in the second article, they described only one con to this treatment, and that was the expense that it took to buy the device. They discussed that the device is so expensive that the benefits may not outweigh the cost. That's basically the summary to my research. Now let's continue with the contraindications, precautions, and application of this combination of modalities. Some contraindications for the use of ultrasound and e-stim include patients with pacemakers, patients with arrhythmias. When we use these modalities, we want to prevent from putting electrodes over the carotid sinus. We want to prevent using these with patients that have DVT, with patients that are currently pregnant, and with patients who have malignant tumors. Additional contraindications include applying these modalities over central nervous system tissue, over joint cement, over plastic components, reproductive organs, or the eyes. When we use electrical stimulation, we want to prevent any muscle contraction around tissue that is healing because we don't want to disrupt the healing. Precautions include cardiac disease, impaired mentation sensation, malignant tumors, area of skin irritation, open wounds, acute inflammation, and epiphyseal plates. Fractures, breast implants, and because ultrasound and electrical stimulation can effectively reduce pain, we want to educate the patient to avoid any activities that will aggravate their symptoms. Adverse effects of both ultrasound and e-stim include burns, blood cell stasis, cross-contamination, infection, skin irritation or inflammation, and pain because of muscle contractions from e-stim. These pictures represent the application of TENS and IFC used for pain control. These pictures here represent the way ultrasound is used on the lower back. On this slide, you can view a video which shows the use of ultrasound and electrical stimulation used together. When documenting electrical stimulation and ultrasound together, you're going to have to document the area of the body treated, the position of the patient, parameters used, electrode placement, treatment duration, patient's response to treatment, the ultrasound frequency, ultrasound intensity, ultrasound duty cycle, again the treatment duration, and the patient's response to the intervention. Here you'll see an example of billing codes used to document electrical stimulation and ultrasound. This is a flashcard for you, my classmates. Our checkoff list. Okay, now it's time for our Kahoot quiz. Good luck. If you have any questions about ultrasound and e-stim used together, you can go ahead and shoot me or Nathalie an email and we'll get back to you as soon as we can.